According to the American Heart Association, more than 2 million people in the United States suffer from atrial fibrillation, and there are more than 300,000 new cases of AFib diagnosed each year. We spoke with Dr. Douglas-Zussman at Hoag Memorial Hospital Presbyterian in Newport Beach, who tells us more about the mini-maze procedure that can correct atrial fibrillation.
Atrial fibrillation, or AFib, that's commonly called among individuals, is that it's a rhythm abnormality of the heart where the two small chambers of the heart will quiver, will not contract properly. We remember in our biology classes that there are 4 chambers to the heart: right atrium, right ventricle on the right side of the heart, and then left atrium and left ventricle on the left side of the heart. And inside, you can see the cavity of the right atrium, and you can appreciate that when the atrium do not contract, blood stagnates within the atrial cavity and then can form clot. So the problem with atrial fibrillation, and why physicians work their hardest to try to control the rhythm abnormality, is that patients intermittently have atrial fibrillation, or this rhythm abnormality. So what will happen is blood will stagnate, a clot will form, they'll go back into normal rhythm, and with that interruption of atrial fib and sinus rhythm, or the normal rhythm, you can send off a clot to parts of your body. 15 to 20% of the cases of strokes are associated with atrial fibrillation.
Dr. Zussman tells us more about the symptoms of AFib.
Symptoms of atrial fibrillation include approximately 60% of people will complain of shortness of breath. Others may complain of lightheadedness, chest pain, fatigue, and possibly even symptoms related to the complications of atrial fib, like a stroke.
And we asked Dr. Zussman how atrial fibrillation can be treated.
There are 3 forms of therapy for treatment of atrial fibrillation. There's the medical arm, which treats you with antiarrhythmic therapy. There's the ablation therapy that interventional cardiologists will take a device, place it through the groin into the heart, and ablate the pathways of atrial fibrillation. Or there's a surgical approach. There's the mini-maze procedure, and then there's the formal operative approach. If someone has coronary disease or valvular disease, we do that procedure with the chest open on the heart-lung machine. And the mini-maze procedure is done in the operating room with a cardiac anesthesiologist. We don't ask for the assistance of the patient. They're under general anesthesia. And we do 2 mini thoracotomies with the use of a scope, which is the video-assisted thoracoscopic scope that we use to do lung resections, lung biopsies, etc. And during that procedure, we do certain ablation lines in order to treat the atrial fibrillation and convert them into sinus rhythm.
We asked Dr. Zussman about the success rate for the mini-maze procedure.
Well, it's very successful in general of the centers that do it. Not everyone will do the mini-maze procedure. It's somewhat difficult and challenging. But the overall survival for paroxysmal atrial fibrillation in converting them into permanent sinus rhythm without antiarrhythmic therapy is between 85 and 95%.